I'm Shignichi, so I am doing my presentation on Streptobacillus, or known as rat bite fever. Some symptoms of this pathogen are fever, vomiting, headache, muscle pain, swelling of the joints, and you will also get a rash on site of the bite. So, this can be a chronic issue if left untreated, um, but it becomes more of an acute issue um, in the because you have to be bitten by a rodent to to get it normally, or there have been cases that's people have gotten it through unclean water as well. So the mortality rate for this though is pretty low, 10%, only 10% if untreated, so it's not a huge issue there. It is a non-congenital uh, disease. It's the infectious agent and structure of this is Streptobacillus and monoilus. It is a highly pleomorphic, filamentous, gram-negative, non-modal, and non-acid fast rod. It is arranged in chains and loosely tangled clumps. How it interacts with the body, it targets the kidneys, liver, respiratory system, sinus, and heart. Um, what it does for the kidneys is it can create lesions on the kidneys to cause problems there, as well as the liver. And with the respiratory system and the sinus, it attaches to the lymph nodes and creates a form of pneumonia. Um, and then with the heart and the cardiovascular system, it creates myocarditis. Uh, so, so there's not too much it's not a very common issue, so there isn't a lot of information on the pathogenesis of this bacteria. So there's very limited information what I could find about how it exactly works in terms of um, the procedure and how it manipulates the body and the antibodies. So risk factors mainly come from you being around rodents, so having them as a pet or working with them in your line of work. So people who work in labs have a higher chance, pet stores, stuff like that. It's mainly passed on from rodent bites. There's, again, like I said earlier, there's been cases where it's been passed on through water, and that is assuming because of the sewer and rats living in the water. Um, the water availability. So some diagnosis of this would be from clinic, confirmed by culture, and sometimes they can see it from the rising antibody titers, not really sure how to say that, um, but it can be treated with penicillin or doxycycline. And the prognosis, rat fever is slightly becoming more common just because more people are having them as pets. But it's not a very high risk thing or something that you should really be worried about. And there's no reason to believe that in the future mortality rate will rise with it. So it's a very low risk, uh, low priority on the on that worry scale. Okay, that's it.